What prompted this report?
Well, Aisling, as you say there, the outbreak at St Mary's nursing home in the Phoenix Park in Dublin almost 3 years ago now was one of the worst outbreaks that Ireland saw in the pandemic. Within the space of a few weeks, more than half of the residents of that nursing home contracted COVID-19 and 22 of them died. This follows then a protected disclosure by a whistleblower who was a staff member at the facility who raised a number of issues of concern. This report, which was commissioned by the HSE, carried out by independent consultants, found that a number of shortcomings really with the preparation for the outbreak and in terms of the response to it. It said effectively that there were a number of significant concerns highlighted, that preparation wasn't optimal within the facility. A number of issues particularly which were of concern. Those include a failure to lock down wards and buildings, a failure to socially distance staff in a number of instances, and the fact that a number of residents were not isolated or moved properly to isolate them, even though they were symptomatic with COVID-19. One of the issues identified was that 2 residents who had dementia were left wandering at one point. It also highlights the fact that there was a number of issues of concern relating to PPE equipment. This is something obviously that was felt nationwide at that point. They say that the supply of PPE was not something that management had any real control over, but it was an issue of distress for staff who were photographed, one member of staff at one point holding a tissue paper to their face covering their nose and mouth. Such was the shortage of masks and equipment at that point. Now, one issue which has been of grave concern for residents' families has been that the communication was very badly. This is something highlighted once again in that report.
Okay, Richard, thank you very much for that.